Hello, everyone, and welcome to Facebook Live broadcast from Parents of Addicted Loved Ones. My name is Dee Pavia, and I am the new volunteer coordinator here in the Phoenix site. Today with me, we have Miss Lisa Watson, and we are just so blessed to have her on board, and she's going to be sharing some really great information with all of you. But before we get started, it is going to be in a question and answer format. We do have some questions that were pre-submitted, but we also welcome all of your questions that you may have as well. So feel free to send those in. In addition, if you want to get notified each time we go live here on Facebook, if you could notify us and turn on your notifications as well on your phone or on your website, that would help us to get this out to you as well. So without further ado, our presenter today once again is Miss Lisa Watson, and she is a therapist and the founder of Inspired Counseling here in Arizona. She has also served as clinical director for community mental health agencies, where she provided guidance and support to the clinical staff, promoting wellness and integrated care for clients and families. More than 15 years of working in crisis, nonprofit, and private practice has provided Lisa with experience and understanding in working with a diverse clientele, facing some of life's most difficult challenges. She earned a Bachelor of Arts degree in psychology from California State Polytechnic University in Pomona and a Master's of Counseling degree from the University of Phoenix. She is a licensed professional counselor, and she is trained in EMDR and TFCBT. Lisa has provided trainings to counseling professionals, university and school staff, law enforcement, and community groups. Her passion is to provide safety and inspiration to her clients in order to facilitate healing and hope for a better future. Lisa will spend a few moments talking about the issue of suicide and those abusing substances, and will also be answering questions sent to us via Facebook. If you would like to ask her a question, please type it in the comment section and we'll get to as many as we can today. And just as a reminder that this broadcast will be available on our Facebook page even after this presentation is over. So please feel free to share it with others and that you think might actually benefit from all of this information. So without further ado, we want to thank Miss Lisa for joining us, and we'll have you jump right in.
You're welcome.
Thanks so much.
Well, thank you for having me today.
Yes.
The reason that I'm really here today is so that I can provide you with some information. So many times I'm working with families who have a loved one who has attempted a suicide or has completed a suicide, and they say, had I only known what to watch for. Or after it happened, they said, oh, there were lots of signs, warning signs that I wasn't aware of. Had I known that, then I could have intervened. And so we're here today so that I can provide you with some of that information to empower you to be hopeful that there is help out there, that you can do something about your situation, and what you can do and how you can handle this in the best case scenario if you find yourself in this situation. Please send questions that you have at any time. One of the things I wanted you to be aware of are people that are at higher risk of attempting or completing a suicide. So some of the populations that would include, and that doesn't mean that they are going to complete, that just means that they're at higher risk because of some of these things. Is our veterans. You hear a lot about that on the news now, how many veterans that we're losing to suicide. Our LGBTQ population, those questioning and struggling with their identity. Native American and Caucasian men are at higher risk, men more so than women, about 3.5 times more than women, to complete a suicide. Our elderly population, lots of those go unreported. Lots of them are very isolated and alone, kind of hopeless that things are going to get better. So we have a higher risk with them. Now we've seen an increase in middle-aged people completing suicides, and a lot of that we're looking at is being attributed to access to medications and pills. And then someone after a divorce or a breakup could be at higher risk for a suicide. These are just things that we're watching for. Someone with a chronic or terminal illness, and especially if they also feel like there's that hopelessness that things are not going to get better. I'm going to have to wake up every day with this pain. I've been to every doctor. There's nothing that they can do to improve this. Why would I want to go on? someone who's been recently hospitalized for a mental illness type situation, because lots of times they will keep the hospitalization as sort of their last hope. And when they go to the hospital and they come out and things are not better or the new medication is not helping, then they feel like there's nothing more that can be done for them. If someone has had previous attempts, that automatically makes them a little bit higher risk for another attempt. If there's been a family history of suicides, or if they've had friends close to them that have completed suicides, lots of times we'll watch this in the schools when maybe a teen or an adolescent has completed and then others around them may complete, so we want to watch them closely. And then if there is a upcoming court that they have and legal issues that they perceive may have a negative outcome, oftentimes we can see a suicide attempt or a completion with that. And then financial loss. If someone has had a huge financial hit, they don't feel like they can recover, that can also lead someone to look at that as an option. And then child abuse and trauma. And that does put them at risk for higher chances of attempting or completing, seeing that as an option. So those are just a few of the populations that if they also have other factors and warning signs, we're going to take those things into consideration as well. Okay?
Yeah, great. That is great information. So do you have anything else that you wanted to share, or did you want us to jump into some questions that were pre-submitted?
Let's look at some warning signs, so that you know what kind of warning signs to watch for. Any of these items in and of themselves does not mean that someone is going to attempt a suicide, but they're definitely things that we want to be aware of. If we start noticing certain things, we're going to reach out for some help, right?
Yeah.
And what happens in families so many times is especially if we're struggling with the substance use, the alcoholism, things like that, there is this gradual slippery slope. You know, it doesn't change just overnight. They don't get to that place overnight. It continually digresses and gets worse and worse, right? And so we don't realize lots of times how things have gotten so bad. Like they always spend all their time in their room. Well, that's isolation, you know, and so we get used to things that are not okay, but it's just been happening so gradually that all of a sudden that's just how every day is, until you have someone from the outside kind of look in and say, wow, these are really concerning things, right? And so we want you to be aware of those. So one of the main things is that hopelessness. And hopelessness says to me things are not going to get better. I can't repair my relationships. I can't get back to where I was financially. I can't get that joy back anymore. And so why go on, right? If life is going to be this or worse, then why go on? We're looking for symptoms of suicide. Symptoms of depression, anxiety. Those things can also contribute to suicide. Mental health diagnoses, bipolar disorder, schizophrenia, things like that also increase our rate of suicide, especially if they're going off their medication and they're not able to be stable. Impulsive behaviors, they're not thinking before they act. Change in their mood or behavior, when we start to see a lot of mood swings or things that are out of their normal personality. And we think, gosh, this is not even my kid. Right. You know, what have you done with my kid or my family member? And people will start to say, gosh, they're not acting like themselves. Something is off. And other people around will start to acknowledge that as well. You may see symptoms of a lot of aggression or irritability. We talked a little bit about that withdrawal and isolation. So they're not answering their phone. They're not going to spend time with their friends. They're not doing the things that they were doing before. Anhedonia, which is a word that means there is no hope, there is no enjoyment. So things that I used to do, if I used to go shoot hoops with my friends at the basketball court, if I used to go out with my girlfriends shopping, or all of the things that I used to enjoy, I'm not finding any enjoyment anymore. Giving away their items, their personal and valued items, all of a sudden they're starting to get rid of those things, giving those things away to people that they think might enjoy them. Making danger to self statements or suicidal statements, even vague, like, well, what if I just wasn't here anymore? They may not say what they're going to do or how they're going to do that. Definitely if they're making plans or have the intent to do that, we're going to be reaching out for help right away. Searching for ways online or reading up about ways to end their life. All of a sudden, they'll have an improvement sometimes, and everyone will say, "Oh, great! They're getting so much better." This is what we've been working towards. But sometimes we'll see an improvement, and then they'll have a suicide attempt or completion. And lots of times that is due to all of a sudden, I don't have any concerns anymore. It doesn't matter if I can't pay my bills. It doesn't matter if I'm going through a breakup in my relationship. So all of a sudden, there's this huge lifted burden and this feeling of being carefree and nothing matters and I'm happy because I'm anticipating an end in sight, right? And so we'll see lots of times an increase in substance use or abuse, and lots of times that comes with that liquid courage. I would step out and do something that I wouldn't normally do if I were not using the substances. If I were really in my right mind, I wouldn't take that next step. If people are feeling trapped in a certain way, maybe I owe my drug dealer a lot of money and I can't pay them and I don't know how to do that. There's no way out of this circumstance that I've gotten myself in, and so lots of times feeling trapped will lead to that, thoughts of suicide. Suicide ideations, talking about suicide, this preoccupation with death. Lots of times in the younger kids, we might be alerted by the school that kids are writing about death in their English project, things like that. If we see them spending a lot of time in those dark places, taking note of that. Obtaining a means to complete a suicide, like going out and purchasing a gun or stockpiling their pills, not taking their medication, but stockpiling that. Change in personality, we talked about that already a little bit. Saying goodbye to people around me that I care about. Having some of those kind of final last conversations. Eating or sleeping changes, if all of a sudden they've been up early in the morning and productive and they're staying in bed all day, or they've stopped eating, or they're eating all the time. Some of those things are symptoms that we're watching for. Some risky and self-destructive behaviors. If I've decided that I'm going to end my life next week, there's no concern. There's no concern for safety. There's no concern for damage that might be done. I'm going to engage in those risky behaviors. Self-harm, and self-harm is not always an indicator of suicide. Lots of times that's how they cope with having some of those thoughts, is through the self-harm. So we really want to look at that, but definitely concerning if they're doing self-harm. And then previous attempts. If they've had previous attempts, they're far more likely to attempt again. And also any of those making end-of-life arrangements. So we talked about like people depleting their bank accounts, right, and giving that out to family members, or giving away their valued things, or making sure their will is taken care of. So things of that nature that you would do when you're looking at planning the end of your life.
Sure. So that's a fairly long list.
It is. Lots of things to watch for.
So as you're looking for them, I mean, what would you say? Is there's probably not a number that you could attach to it. 3 or more of these things could possibly, because at the end of the day, we don't always know, but these are significant signs that possibly that could happen.
Yes, exactly.
Yeah.
And so, like I said, if any one of these things is happening, that doesn't mean there's an attempt in progress or in the near future. But those are the things we start watching for, to be aware of. There might be multiple of these things going on, or maybe there's just one, but over the next couple weeks or months, you start to see more of them. Then it's time to start reaching out and getting help.
Good. That is great information. Thank you for that.
You're welcome.
Yeah. Was there anything in addition or that you wanted to share with us today, or we want to go ahead and go to the questions?
Sure.
All right.
Let's take a question.
All right. So again, we did have a couple of pre-submitted questions, so we'll go ahead and share that now. So the first one, Lisa, is my son abuses substances. He has threatened suicide many times, as in, I'll kill myself if you don't let me move back home. He's threatened it to 2 girlfriends as well. He's never had a plan or actually harmed himself. Like most addicts, he's very manipulative, as in texting, I'll just kill myself, and then turning off his phone, going to sleep. Does the substance abuse change the chances that someone is just manipulating rather than actually suicidal?
It can, not always. I tell people I always take a suicidal threat at face value. It is always very serious when you make that threat. And so, for example, like that situation, I would involve people, possibly if he continues, because you continue to tell me that you are having these suicidal thoughts, right? By posing these threats to me, it very likely can be manipulative. However, you never take that chance, right?
Sure.
And so if I have someone that repeatedly tells me that they're feeling suicidal, then I'm going to involve someone. And lots of times they will say, well, I didn't really mean it. We're going to the hospital, or I'm calling police, or we're, getting an appointment with a therapist. And so I didn't mean it. I was just mad. Then you need to just tell me that you're just mad, right? But if you tell me that you're suicidal, then I'm going to take steps to do what I can to keep you safe and prevent that from happening the best of my ability.
Good. Well, so speaking of which, those initial steps, I think you mentioned a couple of them. What would maybe those top 3 steps be?
Exactly. So what you want to do is, when somebody tells you that, or makes that statement, or even infers that, you want to ask them a little bit further, what do you mean about that? Do you mean you plan to harm yourself? Are you thinking about killing yourself? And it's okay to ask those questions. If we ask those questions, there's this myth that we're planting the idea. They've already thought that if they're inferring those things or making those statements to you. So you want to listen to them. You want to listen to them and not judge. Say, that's wrong, you can't do that. It's important not to minimize. To say, oh, you're just feeling like that today. You've had a bad day, or you failed your exam, or you didn't get that big sale you were planning on. Don't minimize. Always take it seriously. Do not leave them alone if they've reported feeling suicidal. If it's safe for you to stay there, you can call a mobile crisis team to come. You can get someone else to come be with them. But if it's safe for you to stay with them until help arrives, don't leave them alone. Limit access to any sort of means that they could use, like firearms, medications, cough syrup even, ligatures, things that they could use to hang themselves, things like that. You want to lock up any of those things so they don't have access to those if you're really concerned that they may do something. Get help for them. There is help out there, and that's the hope in this message today, that most of the suicides, 99% of the suicides that happened, didn't need to happen. There's always that person, if that's their intent, we can't stay with them 24/7. We can't watch them 24/7. And if they're intent on making that happen, they'll find a way to do that, right? But they don't need to happen. There's help out there for anyone and everyone. Sometimes it's a little bit more difficult with someone who's abusing substances, because they may not be willing to get that help that's available. But get help for them, and then get help for yourself. It's so important that we keep ourselves healthy. We're not able to help them if we're unhealthy, if we're caught up in their addiction. If that's what our focus is now, is trying to save them, then I can't keep myself healthy. And we really want to set a good example for our loved ones, saying, hey, I'm struggling with this. I need to get some help. And so we can set that example that it's okay to get help. It's okay to ask for help when we need it and we don't know what to do. You can call the National Suicide Hotline. That number is 1-800-273-TALK. That will be posted online, so that'll be available for you. Also, here in Maricopa County, you can contact the Crisis Response Network. That's 602-222-9444, and you can talk with a crisis trained specialist over the phone. You can assess if a crisis team needs to come out to assist, and they can help you out with this situation. If there's an imminent danger or an imminent threat, always call 911. Ask for assistance that way. That's your fastest response and safety issue. And then there's also the option of being able to go down and file a petition. It's called an emergent petition. It's a legal process. It actually takes away the person's right to make their own mental health decision because they're actually a danger to themselves or others. So for whatever reason, they're not thinking clearly, they're not behaving correctly, they may be psychotic. And so you can go down and fill out a petition at Connections Arizona or Recovery Innovations, and You can fill out that petition. It's reviewed by the psychiatrist. Basically, it's why you feel this person is a threat to themselves or others. It's reviewed by a psychiatrist. If it's approved, then the police will go pick them up at the location that you put on the application or the form, and take them in for a psychiatric evaluation. So they can be evaluated. That would be against their will. And sometimes they're angry when you do that, but later on, when they get the help that they need, lots of times they're very thankful that you did that.
Yeah, good. Yeah, those are great resources. And again, I know we'll be able to share that with you later as well. So, good. That is wonderful. Do we have time for another question? Is that possible? All right. Let us move on to the next one here. I have a 21-year-old son, and last night he was speaking darkly. He ended up in the hospital with an attempted suicide on 20 Seroquel and vodka, along with cutting his arm. They let him out of the ER. He does not live with me. He has two 5150s, one as a minor and one as of last October as an adult. How do people handle this? He is a Xanax/heroin addict who has been in multiple rehabs.
So one of the things I want to point out is so many times when people are abusing substances, there is possibly a history of trauma. There is a history of mental health issues. There might be a family history of that may not be diagnosed or being treated. And so what they're doing is then they're using the substances to self-medicate, right? So for intrusive thoughts or flashbacks from trauma, things like that, the symptoms of that, they're self-medicating with the substances. And the substances are not helping. The substances are going to make all of that worse. So what you want to do, if they're going to the hospital, say, for concern and they're agreeable to go to the hospital, you want to go to a hospital where they can treat psychiatric issues or they can evaluate for psychiatric issues. A lot of the hospitals, the ERs, they're really about the medical situation, right? What's going on with me physically and medically. And so then once you're medically stable, then they will discharge you and you can walk out the door and you don't get treated for what you really need treatment for. And so, and it's difficult with substances when they have substances in their system because they really need the substances out of the system so we can assess what's causing all of this. Maybe there's depression, maybe there's bipolar disorder, maybe there's PTSD, things like that. But we really can't tell when you're on the substances because what's causing what, right? So what you want to do is you want to be able to get them to a hospital where they can have a psych unit, where they can get an evaluation, and lots of times that's going to follow a detox, right? So the substances are out of their system. But you want to be able to get them the help that they need that's actually driving them to use the substances. So I think that's an important piece, is if you have the opportunity where they actually do get to the hospital, try to get to the hospital where they can get that psychiatric evaluation and treatment that really could be what's fueling all of this substance use.
Sure. So that was one, I guess that's a question I would have then. Do most of the major hospitals here in the Valley or around the major cities, do they provide some of those opportunities for them?
Some of our big hospitals do here. There's private hospitals that do here as well. So they can check online and find out which ones provide that. But I think that's really key. And if you do have the opportunity where you actually do get them to treatment, if they've been resistant, but here's my opportunity to get them to treatment, I want them to be able to get the correct treatment that they need.
Okay.
Right?
Great. Wonderful. And I guess maybe, I don't know if we have any questions that have been submitted, but we can certainly check on those here in just a second. All right. What about parents of loved ones with many addictions who are tempted to end their life? What suggestions do you have for them?
For the parents.
For the parents, yep.
Yeah, and so a big thing for the parents is, and if they're adults, then we don't have control over whether they're going to get treatment or not, right? They're going to choose that for themselves, which is difficult. It's difficult to watch our loved ones struggle and refuse that help that's needed. But the important thing is to get support for ourselves. So be a part of a group, like a PALS group. Be a part of a support group. Get the help that you need. Do your own counseling, your own therapy, and help you work through that process, help you get healthy. And like I said before, we can't help them if we're not healthy. And if we're caught up in their addiction cycle, if we're enabling, if we're allowing this behavior to continue, if I allow that behavior to rule my home, I need to start taking some of those things back. I need to model what healthy looks like. I need to be able to set healthy boundaries. I need to understand the addiction cycle and my part in that, right? If that's a loved one that I'm in a relationship with, how that's affected our relationship, how not to fall into that dynamic that continues this whole pattern. And so really important that I get educated on how to work with my loved one and how to keep myself healthy in the middle of all of this chaos that's going on due to this addiction that's been brought into my life.
Yeah, absolutely. That's so good. And for those of you that may be new and you're not real familiar with PAL or Parents of Addicted Loved Ones, we do have our website, and you can find us at palgroup.org. And in addition to that, you can go on to find a meeting and hopefully locate one that's in your area. If for any reason you cannot locate that, we're also looking for new facilitators, and we have a fantastic curriculum with step-by-step instructions and all those good things, and we're happy to help get that set up for you as well. So just to let everyone be aware of that, that's what PAL's all about at the end of the day. So I don't know if we have any other questions or if you had any other thoughts that you thought might be good to share.
Yeah, I just want to let you know that you're not powerless in this situation, that their addiction does not have to control my life, their mental health issues do not have to control my life, that there is hope, that there is help out there. The more that we can be educated about these things, the more signs and symptoms that we can be aware of, the more resources for help that we can be aware of, that there is hope and there is help out there. There's support groups for them, there's support groups for us. And sometimes until you're in this situation, you don't realize what resources are available to you. So just encouraging you to have hope, to reach out, to never give up. I've worked with people who have had someone in their addiction for 10, 20, 30 years, and they recover. And they get their life back, and their life is fulfilling, and they find that joy again. But if we get so caught up in their addiction and their issues, then we kind of lose our life in that. And so we want to be able to encourage them and be support for them, but we need to be healthy ourselves.
Absolutely.
And so just know that there is, if you're in that situation currently with a loved one that you care about, a friend, a family member, if you're in that place yourself, there is hope. If you have those thoughts, if you are feeling hopeless, if you've thought about suicide or contemplated that, I want you to know that there's help out there. And so don't give up. Don't ever give up. It can always turn around. And so many times we talk about the point of a crisis, which seems to be possibly the worst, lowest point in our life, can actually be the catalyst. If we're willing to reach out and get help, that crisis can actually be the catalyst for turning things around. And all of a sudden, there being hope again. And so I am connected, pals are connected. There's so many resources to people that we can help direct you to get the help that you need in order to turn this thing around.
Yeah, I agree. I love that. I always think, when we're going through the darkest times of our lives, it's when we're reaching out and when we're seeking, that hope, that's when it just comes to light. And that's when life, it can get better and there is hope. So I really love that you do what you do and share this message. I mean, it's so important for so many people. All right, I think we have another question that's come from online. My family gets so angry with my son when he talks this way. What do I say to them? So maybe some tips for parents of children that are struggling, and what do you say to the family? That is a big deal. That's a pretty big deal, because as you know, with addiction, it doesn't just impact the immediate family, but everyone else is involved as well. So what would you advise for that?
So anger is a secondary emotion, and underneath that there's something that's fueling that anger, right? And so when it comes to suicide, so many people are uncomfortable with that. They don't know what to do with that. They feel helpless in that moment, I'm not prepared to deal with suicide. I don't know what to do with this. And so there's a sense of maybe fear or frustration that they keep throwing that out there if they feel like that's manipulating. Maybe they're hurt that they didn't come to them or, lean on me for support. So there's lots of reasons. Family may be angry. So there's not one particular thing, but depending on the family and the dynamics and what's going on in that individual life and the family's life, there can be a lot of different reasons for the anger, right? And some of it is very justified, right? Given maybe the path that has led them to this. But really trying to go back to keeping everyone healthy, getting that person the help that they need, right? If someone throws that around a lot, I'm not going to let that go on continuously, right? When that comes to light, I'm going to be acting on that. I'm going to be reaching out. I'm going to be getting help. I'm going to be taking that person for help. So we want to kind of break that pattern if that is a manipulation tactic for someone who might be abusing substances and that's how they get money or that's how they get their drugs or whatever's going on. We're going to intervene there either way.
Sure. So to tack on to that, actually, when you talk about that, when we talk about the impact on the family, not just the immediate, but the extended,
Right.
What are your thoughts around that as far as, do you have suggestions? Should extended family members be communicating with one another about this maybe particular individuals to kind of align it and that sort of thing? Or what are your thoughts on that?
Well, and that's important if those family members are helpful to the situation. Sometimes the family members become really toxic and they're not helping the person in the addiction or the person who's feeling that down and depressed and suicidal, that they're thinking that that's an option for them now. Sometimes those people are very toxic and that's not helpful to the situation. So if they know how to be supportive with those healthy boundaries,
Sure.
if they can encourage that person maybe to get the help, maybe it's maybe I can't get my family member to go get help. Maybe they won't listen to me. Maybe we don't have that relationship. Maybe it's another extended family member, or maybe it's an outside friend that's the person that has that connection with them. By all means, if you're a positive support in this environment, please be involved. They need that support. I
Sure.
need that support, right? But if they're negative, if they're toxic, then that is something that we don't need that involvement.
Sure,
Right.
good. So it's important to set those boundaries as well.
Yes, definitely.
Good. That's great. Good information. I think we have another one. This is wonderful. I'm going to give credit to Miss Dinah, our Director of Communication. She's helping us out today as well. Why can't the hospitals have on-call counselors that can help as soon as a 3-hour hold is up? It just seems they let them walk out still sick.
Yeah, they do. And I think part of that is the importance of getting them to a place where they can treat psychiatric issues, where they can treat substance issues, where their staff is trained to deal with these issues. Because if it is a medical hospital or a big medical center, their job is to keep them safe medically, right? Or get them safe medically. So maybe after a few hours, a couple days, we've got you on the appropriate medication, things like that, and now you're stable. Your vitals are fine, right? I've heard this many times, well, their vitals were good, and they allow them to walk out the door, right? Because that's not their role. They're there for medical emergencies. They're there for sickness, for, disease, things like that, treating those kind of physical things. So when we're talking about substances, mental health issues, and especially if they have substances and they go to the hospital because of an overdose or things like that, once that emergency is averted, right, there's no more reason for them to be there in a medical hospital. So that's why we want to have them in substance abuse treatment. That's why we want to have them in a facility where they can be addressing those psychiatric needs, mental health issues, behavioral health issues. Then they can keep them longer. They can be there for a longer stay.
Okay, great.
Yeah.
And it kind of goes back to the conversation earlier, right, with regards to those hospitals. So do our homework, right? Make sure that we're checking the ones that might be more applicable to
Yes.
the issues we're talking about.
Yeah.
Okay, good. That is great. Good information. Any other points that you might have with regards to that? I know that we touched about the extended family and those dynamics. Are there any other pieces with regards to that particular topic that might tie into, say, suicide in particular? Yeah.
Sure, sure. Recognizing those warning signs, taking the preventative measures that you can to keep them safe, right? Limiting access to means, things like that. Knowing what things to watch for, and really taking it seriously. And I think those are some of the key things that we can do. Listen to what's going on with them. What got you to this place where you feel like you need to take your life? Like that is the only option that you have. And so, working in the crisis world, teens and young college people with a breakup. As adults, we think, oh, you're young, you have, many more people to date before you'll, be in a long-term relationship or before you get married or whatever that is. They don't have that foresight, right? They don't have the life experience. Their brain is not fully developed. And so they feel like that is their only, person in the world, and that didn't work out. And so why go on? So we see a lot of that with the younger population. And so just watching for some of those things that are really crucial, like when you have someone in your family who's really focusing on just noticing the dark things, the negativity, not being able to see any good or positive. Be aware of those signs and symptoms, and just kind of put that in the back of your mind, like that's concerning to me, right? And when we start to see more and more of those symptoms, we don't have to wait until they're actively suicidal. We don't have to wait until they disclose a plan or when they're going to do this. And sometimes people are with mental health issues, and lots of times they're co-occurring, so we'll have mental health and substance both going on. We can go down and file a petition, and if that petition is alerting enough to the psychiatrist, if we have the signs and symptoms, they can pick them up even though they're not claiming that they're going to go out and kill themselves. There are certain criteria that need to be met for a petition. So if they're on medications, they're not taking their meds currently, they're refusing to get help, right? And then they're giving us signs or symptoms or statements to make us think that they're a danger to themselves or others, that petition can still go through. And so they might be psychotic in the moment, and they might be putting themselves in harm's way. I've seen people who were psychotic in the moment, and they're walking down the middle of a major street. They're putting themselves in harm's way without knowing. They're not intentionally a danger to themselves, but because of their current mental state, they are a danger to themselves because they don't have the insight to understand that I'm putting myself in a very harmful situation.
So speaking of which, what do you say to the parent or the loved one that they see that person, there's clearly an issue, I need to contact someone, let's say it's to 911, I need to call. So, what do you say to that parent that is then concerned, well, what if they just take them and throw them in jail, or they just, what do you say to a parent that's concerned about something like that?
Yeah. Lots of times, like law enforcement and mental health professionals will work hand in hand. So lots of times, maybe if you call for a crisis team, police will come because maybe there's weapons, in the home. Or if you call police out, and now a lot of the cities have mental health trained professionals that are part of their law enforcement team, which is great. If they don't, then they'll call a mobile crisis team out, and they can work hand in hand. So they can recognize that there's a mental health issue going on, or depression or suicidality going on, and they can work together to get them to the most appropriate level of care, right? So police are going to take them if there's a crime a crime happening, or if there's a legal issue going on. But really, if they're there to help, right? And so they're there for more of a safety concern to the person, to the family, to the team, if there's a safety concern. Lots of times they will come and just provide support while the crisis team is there, so that they make sure everyone is safe and that they can get to where they need to be. And so sometimes they, will help the team in transporting if the person is kind of belligerent and not willing to go, or things like that. And so sometimes they can be a big help and assistance. it's not often that they just take them and throw them in jail for,
Sure.
no reason if they understand that there's a mental health issue going on.
Mm-hmm.
They want to get them the appropriate help as well.
Good, that's good.
Yeah.
So I would assume it's important to communicate that, right? So if we were to contact 911 or
Definitely.
whatever, make sure that that's communicated to them. So just, maybe they can have those people heading out at the same time.
Yep,
You
you
know.
bet.
Yeah, good. That's good.
You bet.
So another question, can we hear more about treating mental health issues combined with substance abuse? I'm afraid of my son.
Yeah. And so that mental health and substance abuse, so many times we see that hand in hand. Like I said, if you have a mental health issue, lots of times it's so interesting when people will say, well, I'm not taking meds for this mental health issue, but then I'm going out and I'm drinking excessively, or I'm using drugs, or I'm taking pills that are not prescribed for me or not for my symptoms, to alleviate those symptoms that I'm feeling due to the mental health issues, right? So basically what you are doing is you are medicating, you're just using another substance, right, to do that, as opposed to the medications that are intended to help you with those symptoms. And so lots of times those go hand in hand. Previously, years ago, when I would go to a crisis call, the facilities would treat either substances or mental health, and lots of times they're working together, right? And so now they recognize that the system recognizes that, and so lots of times they have help for both substances and mental health issues, because so often they're going working together. And so the issue about you're wanting to be able to get treatment where you can address both of those, right? Because if you just treat one and the other goes untreated, we're still going to have problems, right? And so if you just get them clean and sober and we have mental health issues that aren't being addressed, we're still going to be struggling, right? And vice versa.
Yeah.
If you're treating psychiatric and mental health issues, but they're still abusing substances, we're kind of right back to where we started.
That's right.
And so we want to be making sure that we're diagnosed appropriately, right, and getting the proper treatment. The thing about being afraid of your son, that it just depends on the circumstances there, and I'm sorry that you're in that situation. But is it something where they're in the home and they need to be removed from the home? Our home needs to be our safe place. And so if they're in the home and you're fearful of them and they need to be removed, sometimes they're not in the home, or they are in a home, we need to get a restraining order or order of protection put on them. And I know sometimes that seems extreme and hard to do, especially because the person is probably going to be angry with you, right, and agitated. But we need to take those steps in order to keep ourselves safe, so that we can do what we need to do for our loved one, right?
Absolutely.
Safety is always the number one and first issue, right? Before we can do anything else, before we can do treatment, anything else, we need to make sure that everyone is safe.
Sure. Yeah, and I really like that piece, just because, again, we keep going back to it, but it impacts everyone. It's never just about the addict. It's never just about maybe the one parent or the parents that are dealing with it, but you could have a whole household, right? And that's so important to make sure that everyone is safe. So that's really good. Another question is, how do I find mental health and addiction treatment in areas other than Arizona?
You can call. There is the National Suicide Crisis Line. Different places have information for different cities. So they may have listed a crisis hotline in Cincinnati, Ohio, or New York, New York. So you can contact places like that. Always you can go on the internet and Google and all of those great resources that we have now. But if you contact some of the national crisis lines, they can direct you to other resources in your area.
That's good. Very good. All right, we have another one. Here we go. All right, most of us don't have the skill set if other members don't, or if other family members don't think they're sick, that they're just bad people, and we feel alone. We need support. What are our options?
Yes, definitely. So you definitely can reach out and get your own, counseling and therapy and support that way. You can reach out to organizations like PALS, where there's support groups all over the country now, and they happen different days of the week, different times of the day or evening. You can go to a group. There's no charge for those, and you can get support there with other parents or other family members or spouses or children of people who are struggling with addiction and substances and that sort of thing. There are support groups all over our country. You can reach out to organizations like NAMI, the National Alliance of Mental Illness, different places, and online there's lots of resources for support, so you can reach out for different support for yourself to educate you on possibly your loved one's mental illness, to educate you on their substance addiction, their alcoholism, things like that. So there's support groups nationwide that you can reach out to and get support for yourself. Obviously we're working together with PAL, but those are all over the country as well, and so you can reach out and get support from those groups.
Yeah, absolutely. And as Lisa mentioned, again, for those of you that are new to PAL, the meetings that we have set up, generally if you were to go to a PAL meeting, they usually tend to happen at least weekly, once a week, and we have a curriculum that you get to follow for the first portion, and then you get some peer support for the second half of that. And it's very open, it's non-judgmental, it is a wonderful environment to meet others that are going through the same struggles as you are, and it really does do something for those that really are in need, and of just having that support. And there's also so much of the educational piece to it. There's so much involved with that. You learn so many things, just like Lisa's been sharing with today. You get those in regular PAL meetings as well. So again, just to encourage any of you that may be new, definitely check out the PAL meetings. We have them all over the place, and good to go.
One more
So.
question.
Final question, is that
No,
right?
I'm going to just read this one.
Oh, sure. We're going to have another question read real quick by Dinah.
My son has met every criteria you've brought up concerning suicide. He is facing jail time, huge financial fines, no employment, and a partner enabling him for now. He's made suicide attempts in the past. Our fear is losing his current relationship along with his current uphill battles, and he doesn't see any future ahead. How or what does our encouragement look like?
Well, and the best thing that we can do in those circumstances is to encourage that person to get help. I don't know what state that you're coming from. Here in Arizona, if you're meeting those criteria, we have the petition process if they're not willing to get help. And, that's a difficult step to take. A lot of families say, oh, I don't want to do that. That will make them so upset with me. I'm afraid that will damage our relationship, things like that. But right now, you're already basically in a crisis situation, right?
Yeah.
If you're meeting all these criteria, if you're recognizing all of these symptoms, if you've already had multiple attempts and hospitalization, you're really in kind of a crisis place, right?
Yes.
He's feeling hopeless. He doesn't see how things can turn around, at least with the skills he has on board or resources that he has or doesn't have on board at this point. And so really you want to involve professionals who know how to do this. So here in Maricopa County, we have mobile crisis teams that run 24/7. You can call the numbers that we've given to you that Dinah's going to put up online today and reach out for help. In our process here, sometimes it's helpful to have a mobile crisis team assist you in filing that petition. So they're actually filing it instead of you. That process does require that the person that's filing it to have witnessed these things firsthand. So lots of times, unless I've seen it, but sometimes we go out and they're not willing to engage initially. They say, I'm not talking to anyone. And when the crisis team gets there, they do open up. They say, that's not right, Mom. That's not how it is, and they'll want to speak for themselves and they will open up. So most of the time we were able to engage that person. We were able to help, either get them to help, right? Because we're there to help. They recognize we're not there to take them to jail. We're not there to turn them in, to snitch on them. We're there to provide help. So lots of times a crisis team is able to get someone to help where the family members were not able to do that. And also if a petition is necessary and the crisis team is able to witness some of that, they can go down and file the petition. If police officers are there and they witness that, they can go down and file the petition. So there is a lot of options. There are a lot of options, I should say, and there is a lot of help available. It just takes that person reaching out and engaging in that help.
Sure. So Lisa, I'm not sure if you can share as much on this piece, but once that process begins, so let's say you filed that petition,
Right.
what does that now look like?
So what that looks like is there is a 24-hour period where the petition, there's a pickup order that will be sent out to the police department, law enforcement in that area for that person. They will make several attempts in a 24-hour period to pick that person up. If they can't find the person, or if they refuse to come to the door, things like that, and they can't execute that petition, then the petition is dropped, and then what happens is you have to start that petition process over again, right? You have to go back and refile a petition, and I know it's tough, but given everything that you've been through up to this point for maybe months or years, this could lead to the help, right? And sometimes on occasion a petition will be denied, and so that's one of the reasons that maybe having a crisis team assist is helpful, so that you know what kind of things that they need, that information on that petition form, know what kind of things that the doctors are looking for that make that person a higher risk for danger to self or others, right? And so to have that assistance is always good to know kind of how to fill out that form and what kind of warning signs that symptoms they're looking for. Sometimes it's denied, but maybe the next night or that same day something else happens that helps to meet that petition process. Go back and fill it out again, because now you're going to add that new piece of information, which then would help meet that criteria of being able to be picked up so they can be evaluated and get the help that they need.
So there's another piece to this that I just thought of. So many times when it comes to addicts in particular, one of the personality traits is being manipulative.
You bet.
So
You're
let's
very
say, right? So let's say we have somebody that's come out now to come pick someone up, and they have all the right words. They know it like a script on what to say. So these police officers just walk away and say, this person does not have an issue. How do you deal with something like that?
And that's a good question, and that definitely does happen. And so many times they're very intelligent, or they've been through the process many times, and so they know what to say and they know what they're looking for. And therein lies the importance of having the family member, a loved one, someone who's been through this with them there on scene when this happens, so that you can provide that information. There's been plenty of times where I've been with a client in a crisis situation, and they say, well, if you petition me, I'm just going to tell them this, or I'm just going to tell them that, right? You misunderstood, or no, you misheard, or whatever it is. I include that information in the petition. I say, that the client stated that they are going to not deny this, when the police come, or they're going to deny this. And so I'm very upfront, about that, and let them know, whoever that I'm working with, whether it's police or, the petition process, that they reported that they will deny this, so that they know that. And I also want to say, in that whole petition process, they will not pick up someone on a petition for substance abuse alone, substance-related issues alone. So there has to be a mental health component to that. I can treat mental health issues with psychiatric medications, right? I can help the depressive symptoms. I can help the anxiety. I can treat that. But if it's purely substances, my medications, if you're using the substances, my medications are not necessarily going to help what's going on, right? And lots of times, if I give you a psychiatric medication, that could be a detriment if you're mixing that with alcohol and drugs, because that's not their intended use, correct? And so just know that if it's purely substances alone that are causing these issues, the petition will likely not go through. If someone is actively suicidal, then of course we're going to call 911 and have law enforcement involvement and that sort of thing to keep them safe. Always going back to safety first. Right.
Yeah, that's good. That's good. So you had mentioned, when it comes to these petitions and things, and I know that you mentioned a couple of places that you could go to for that, and we'll be sure to post that. But is that something also as counselors and folks that are doing work, do you also help in that process as well, or is that something you just generally refer them out to?
Yes, normally you would refer that out unless that personally happens in my office with my client, or they send me a text stating that they have plans to harm themselves or they're being suicidal, and we talk about that in counseling when we're together. We talk about what that looks like. But if that came up and that was an issue with like for example, one of my personal clients,
Mhm.
I would need to go down and file the petition.
Okay.
Yes. Yeah.
Okay.
And that has to be done in person. You can't fax that in or email
Right.
that in or phone that in. That has to be done in person.
Sure.
Yeah.
Interesting. I mean, it's great that we have all of these resources.
Yes.
And, I know, again, you talked about it earlier, but when people are faced with this, I mean, chances are if you're watching this today, chances are if you've been looking things up on the web, you've been asking people, you're probably already in crisis mode, and that is the time to reach out and not, stay hidden and just hope things go away, because that's pretty much not going to happen, right?
Yeah.
We need to take action. And this has been great information.
Good.
Really appreciated it. I don't know if we have any more online. I think we might have another question here. What are your top 3 suggestions for hope for parents concerned about their loved one in suicide? What would your top 3 suggestions be?
I would say 1, educate yourself. Educate yourself on the warning signs. Educate yourself on the resources. 3. You have to limit it to 3.
There's so many. Yeah.
Through reading, articles online. There's videos now. There's all sorts of resources available to us to educate ourselves on the addiction and that whole thing. There's education for mental health issues. There are support groups out there available in the community. If you don't like one that you go to, don't give up. That's not necessarily how they all are. Go to another one.
Good. That's
People may
good
go to
advice.
one AA meeting or an NA meeting and they didn't like somebody in the group, or they went, or they went to a PAL group and they didn't like somebody there. Don't give up. There are other groups and there's support out there. And then I would say get help for, if your loved one is not willing to get that help right now, that doesn't mean they won't be able to down the road. Continue to try and encourage them and to support that idea of getting help, right? So go to a meeting for yourself, get help for yourself, educate yourself, get help for yourself. And I would say, don't give up, don't lose hope, that there is always hope that things can be turned around.
Right. That's so good. I really, really love the piece, obviously, because of PAL and Parents of Addicted Loved Ones, but I love the message of getting help for yourself, because I think at the end of the day, we can exhaust all effort in trying to help our loved one because that's where our heart is, but truly, we're only as beneficial to them as we can be to ourselves. So I love that message, and I think that's what PAL's all about. So thank you so much, Lisa. This
You're
has
welcome.
really been a great session. I've enjoyed it. I hope everyone else has gotten a lot of information as well. And we'd love to see you around next time. Be sure to, contact us, leave your information, palgroup.org. We would love to hear from you. Thank you.